Oh, my. When I first, I think it was Dr. Corneye, my primary care doctor, who diagnosed it, the COPD, and it wasn't until sometime later, maybe 2 or 3 years, when I'd go for my regular checkup, or if I had bronchitis or something like that, that she never mentioned emphysema. And I'll never forget the time she mentioned emphysema. That really hit me. And I thought, oh, I can't have that. But I knew it was from smoking, 45 years of smoking, which was what I learned how to do in college because it was the smart thing to do and so sophisticated. Then he suggested that I take, that they had a harmonica therapy group. And it was for playing for the harmonica for fun and for health. And I think that group had been, at that time, going for maybe about 5 years. And so I thought, well, it sounded like it'd be fun. And so I asked my husband if he would do it with me. And since he is retired, and he consented to do it with me. So it's been a lot of fun with the two of us at home. We can play together, and I most enjoy it when I get to play all the little songs that I know and familiar things, and I can make up songs using all the techniques that we're learning in the class, and we're still learning a lot. It's like you when we were in the pulmonary rehab class. We learn how to do what they call pursed lip breathing, which is you breathe in through your nose and then out with pursing your lips like this, twice as long as when you breathe in, and that forces the oxygen more back down into your lungs, and it opens up the lungs, and this is a tremendous. It was one of the number one things I learned in that whole rehab class was the pursed lip breathing. Athletes do it too, when they're lifting weights, and they breathe out as they put the pressure on. Anyway, it's helped a great deal. I know when I don't play the harmonica, and that's happened where we've been off for maybe a month or two, and I can really tell the difference. Not until I start in playing it again, and then I think, I've got more energy now that I'm back playing. I have a little oximeter. I carry it with me in my purse, and I can tell what percentage I am, usually when I'm playing the harmonica, whether I'm on oxygen or not. I use the oximeter, and I can get up to 98, 97, 96% blood oxygen level, and otherwise it can be down in the 80s, like 86, 87, 88% oxygen level. Oh, they're a tremendous group. They're not only helpful, but they are so knowledgeable, and they've just become a bunch of friends, and they're just dedicated to seeing that all of us learn to be better breathers. I haven't had a cigarette since February 14th or February 12th, Lincoln's birthday.
Yeah. Oh, should we get that on camera?
At 1:17 in the afternoon, I put out my last cigarette. We have lived all over the country. In my husband's, before he was retired, we moved a lot, and in other countries too. And excuse me. And so as a result, in our medical care, we have seen a lot of various hospitals and various doctors, both here and other countries. And this is top notch. They're amazing. It's the most caring hospital I think I've ever had any association with. All the personnel are great. Let's see.